Hi, welcome. Today we're going to be looking at pregnancy massage. So my wife is 39 weeks pregnant, so even though it's a bit of a windy day today, we thought we better get in and get this video done before the due date. So there's certain things that we have to be careful of with pregnancy massage. We don't want to use many essential oils. A lot of essential oils can stimulate labor, or they can cross the bloodstream into the baby. So generally I tend not to use much oil, or if I'm going to use an oil, don't use any sort of essential oils in it. There's certain pressure points we're not going to use during pregnancy massage. So the point in between the thumb and the finger, large intestine 4 in Chinese medicine, that's considered a stimulant for contractions. So you would only use that during labor itself. We're not going to work too deeply around the ankles. We're not going to work into here very deeply, and we're not going to work very deeply into the belly, obviously. So very, very gentle, maybe soothing touch for the baby. But where we're going to focus on is tension around the hips, in particular the sacrum. Okay, so that a lot of pregnant women get a lot of pressure around their sacrum and can get lower back pain and that sort of thing. So we're going to work from the feet up, just as we do with regular Raynor massage, but we're really going to focus on keeping that sacral area loose, opening that area up so there's no tension. Obviously, when a woman has tension, if she's going to give birth, that's going to make it more painful, because the baby's going to be, as the baby's coming out, it's going to be pushing up against that tension. So our main goal here is to provide that tension relief, getting rid of that tension from the roots up, again from the feet. We can do the arms as well, but mostly we're going to be focusing on the feet and leading up into the hips, and especially the sacrum. So we're going to get into that. Okay, so when it comes to the placement, with pregnancy massage, we're generally going to be working in the side position. And one of the important things here is that we have bolsters. So I've got some pillows underneath her knee here, and we've got another pillow underneath her foot. Okay, you can also put a bolster underneath the baby, in the tummy, and you can even have another bolster on her, under her arm, if that's comfortable for her, if she needs that. And of course we have a pillow for her head. So one of the main areas I'm going to be working then is around the sacral area. All right, so we can feel around the hips in particular and just feel how tight is she. And again, I'm not going to be working her as deep as I would if she wasn't pregnant. All right. Another thing about pregnancy massage, I'll just let this wind die down. This is very close to her sacrum. So her sacrum is through here, and I'm working just above it. How's that pressure? Okay. All right, so a lot of women get a lot of pain right through here. So we've got the spine coming through here, and then we've got the sacral bone up in this triangle like this. We don't want to work over the bony bits, but we're working over the big toe belly band that's coming right through here. We can also then come up into the hip here and feel how tight is she in here. I was going to say, I don't like to do deep excavation style massage on a woman that's pregnant if she's unhealthy. For example, somebody who's on a junk food diet, smoking a lot of cigarettes, taking drugs, that sort of thing. We have to be careful of the amount of toxins that we're going to then stir up, because they can cross over the placental barrier and come to the baby. Better off doing deep excavation massage before a woman becomes pregnant or after. But if somebody's relatively healthy and we're not worried about too many toxins coming out, then massage throughout pregnancy is a great idea. All right, so I'm really focusing on the area of the sacrum. So we're just above the bone here. And Corey's got quite a bit of tension in there. How's that pressure? Is that okay still? So always again check how's the pressure. Even if a woman normally likes hard pressure during pregnancy, things can be a bit different. Okay? So really just working in there. And again, we can then follow that all the way down. Right to the very tip, to the big toe, so right along the edge here. And into the side of the big toe. And right along that band, so we call that the big toe sacrum band. And then following it up like this. Not too hard in the back here. These can be pressure points to do with activating labor. They can be used during labor though, to facilitate the birth. Okay, so coming in under here, so beside that bone. Just getting all those toes back into position. We can also work this outer band because that's going to come up and add to the tension in here. So working from that little toe up the side here. How's that pressure? That's good. Okay, so just up along the edge here. And again, not too hard a pressure at this stage. Just wanting to take away the tension that's come over the last few weeks, or with the expansion of the bodies I should say. Okay, can still use a little bit of elbow pressure if she's okay with it. How's that? Yeah, so normally I would work Corey a lot harder than this. So I'm going at about 20-30% of the normal pressure. You can still do this if she's okay with it. Again, just that. How's that feel? Just freeing up that hip. And a lot of focus in this area here. Just really opening all this area, all the nerves that are coming out from the spine. So we're not working on the spine itself, we're working above it. So the spine is here and we're above it. Really into all this area. It's a very powerful and important area, actually, I find in all forms of massage, or with Raynor massage, but especially in pregnancy. And this is where pretty close to here is where they would put an epidural in it, which I think can leave a lot of problems, so I think it should only be used as a last resort. But generally speaking, we just want to really, we can follow this up her back. Right up into her neck. Oh yeah, that's tight up there. We can still do our shoulder rotations. Again, I consider pregnancy massage is generally done more as what I would call a maintenance form of massage, so not as much intense chopstick work on the tips of the fingers or toes, because we're not trying to excavate, we're trying to maintain, we're trying to get rid of the tension that's built up recently. We don't want to go to the higher levels of intensity because it can, it could cause quite a reaction with the baby. So that could cause a miscarriage. We don't want to do that, or early onset labor. So it's more just, and again, this is the point I was saying, normally I would work this point, and I know Corey feels quite tight in there, but I'd probably leave that at least for another week or two until we're trying to induce labor. Okay, if we're getting to week 40, 41, then I might think, oh well, I'll give that a push, so another week or two, and then it's okay, because it's going to help stimulate the labor. But it feels very tight in there, but at this stage I'm still going to leave it, even though 39 weeks would be quite acceptable for the baby. Okay, so just getting in, moving the joints around. Still just, a little bit of stuff, but just not quite as intense. So points, bands. It's what I call taking away any tension that comes away nice and easy. And Corey's pretty easy to work on. Pressure's still good? So if a woman has certain high risk, got a high risk pregnancy, a massage should only be done with the doctor's permission. Same with high blood pressure, and anything if in doubt, always get the doctor's permission beforehand to make sure that it's safe to do. Or the midwife, of course, if you're not using a doctor. Midwives can actually, some midwives know a lot about good pressure points too. Okay, so I'm finding a lot of tightness just in here. Again, I'm just going to raise that leg a little bit. breath. How's that for you? Out of 10? 9? Okay. Okay, and I can hold that spot there. Again, loosening this whole area will just help with the ease of the labor, reducing pain, and yeah, generally get rid of like lower back pain and things like that as well. You can always do a face massage, which I've shown in other videos, which isn't really any different, if a woman can lie facing up. Some people like to use the pregnancy massage tables with a hole in the middle, but there's been some studies to show that they're actually not that good because the elasticity of the ligaments in the uterus can be stretched with the baby hanging through the table. So generally speaking, it's just best to use a regular table with bolsters. And if you don't have bolsters, just use some rolled up towels. Bolsters or pillows. And just do it to the woman's comfort. Get her comfortable first. Okay, so now I'm just getting in up here around the shoulders. Back to that sacral area. I can work this inner part of the leg here as well. Again, just feeling those bands for when I come to turn her over.